So today we'll be talking all about why herpes does not go away. So, genital herpes is a common infection that causes sores or blisters on your genital, and it is caused by the herpes simplex virus 1 and 2. It is a contagious sexually transmitted infection, and the sores can affect your vulva, that's the external part of your vagina, including your vaginal lips, the vagina, the cervix, the penis, the testicles, the anus or the butthole, the rectum, the buttocks, and even the groin area. So, symptoms may vary depending on if it's your first outbreak or if it's a recurrent outbreak. Recurrent symptoms are usually milder than your very first outbreak, and they do not last as long as the first outbreak. So in your first genital herpes outbreak, the symptoms appear typically between 2 and 20 days after getting the infection, and it may even last up to 4 weeks. So you can have flu-like symptoms like fevers, chills, fatigue and body ache, genital itching, burning or irritation, painful genital blisters or sore that break open, headaches, painful urination, swollen lymph nodes, or even unusual vaginal discharge or discharge from the urethra. That's the tube that carries pee outside of the body. So, as I said before, genital herpes can spread through intercourse, including anal, vaginal to penile, and even vaginal to vaginal. It can also spread through oral sex, whether you're giving or receiving with someone who is infected, skin-to-skin genital contact, touching open sores, including while you're breastfeeding, and even child's birth by a parent who have an active infection. The baby can get it. Healthcare providers know that certain activities tend to reactivate the virus, and this can include stress, illness, your menstruation, sun exposure, and even surgery. So a very important question that's always asked is, how did I get herpes if my partner does not have it? It's important to note that some people may never develop symptoms. They don't know they have the virus that causes it, and they may unknowingly infect others. So they may think that you went out and get it from someone else and bring it back to them, when in fact they were the ones who had it before and was not having any symptoms. Complications from genital herpes can include an increased risk of getting HIV, infecting your baby if you are pregnant with herpes, internal inflammatory disease like things that inflame your urethra, your cervix, your uterus, and your rectum, and even eye or finger infection, your immune compromise. If you already have an illness and you experience severe outbreak, sometimes genital herpes can infect your brain, and that's what we call encephalitis, or the membranes of your brain and spinal cord, and we call that meningitis. You can breastfeed if you have genital herpes as long as you don't have active infection at the area. So as regards to management, there's absolutely no cure for genital herpes at this time. But there are many ways to treat the active genital herpes outbreak. So we can use some antiviral medications like acyclovir, and these are known to reduce the severity of the symptoms or future outbreaks, even help heal the sores quickly. And some at-home things you can do is that during the outbreak, you can put an ice pack on your genital, wrap the ice pack in a washcloth, and apply it to your underwear. Keep your genitals dry, so you wear a cotton or non-synthetic underpants, and avoid tight-fitting clothes because moist sores can take longer to heal. Soak in a warm bath, and even take non-steroidal anti-inflammatory drugs like NSAIDs to relieve any pain that you're having, and even apply topical 1% or 2% lidocaine to basically numb the area. Always wash hands after contact with genital sores, and try not to touch the sores as this increases the risk of spreading it to other parts of your body. Just communicate with your partners, and do not have any intercourse or touching of the areas if you have an active outbreak.